Person asks, what do I think of hormone replacement therapy? I'm a big fan. I just have to do it the right way. And it has to be done based on the right testing. So hormone replacement therapy, progesterone, estrogen, testosterone, bioidentical all the way. That would be my only way of doing something. That's the way my provider, the medical providers here in my office do hormone replacement, is they'll use bioidenticals when they're necessary. But they base their hormone replacement on the right testing, not just blood hormone levels. Blood hormone levels can be valuable, but understand it's a bit like looking at your car and trying to determine if there's enough fuel in the tank. And so you look at the blood levels and you say, look, there's plenty of fuel in the tank, but it doesn't mean your cells are using it properly. It doesn't mean your cells in your liver and other parts of your body converting those hormones properly, conjugating those hormones, getting rid of hormones, changing them into other forms. All that happens in the tissue. And by looking at hormone levels in the blood, it doesn't tell you how the car is actually running, so to speak. The best hormone test that I've seen is the 𝗥 test. 𝗥 because it's called the dried urine test for comprehensive hormones. It is the best hormone test. It's the test that we do in our office. It looks at all the metabolites, all the hormone levels, all the things, and how those hormones convert from one thing to another. But we don't just leave it there. We also go into making sure we're really understanding somebody's blood work that relates to hormones, how their stress is doing, how their inflammation's doing, how their red blood cells are doing. Do they have any underlying infections? What's the toxic load look like? What are their kidneys doing? What's their cholesterol look like? Blood sugar. All of these things matter before we just start putting somebody willy-nilly on hormone replacement therapy. There's a lot of things that need to be fixed before you put somebody on. If they're wrong, there can be a lot of things that need to be fixed before we put somebody on hormone replacement therapy. Otherwise, you could be getting the dose wrong because your body isn't actually short on hormones. It's not making them for a reason in some cases. So getting to the root cause of why somebody might not be producing the proper amount of hormones is important before you just put somebody on hormone replacement therapy. Anyway, if you need help with hormones, you live in the area, happy to help you. I'm not coming on here to tell you this. As far as most people that are watching this do not live in Middle Tennessee, but lots of places out there can do the 𝗥 test for you and get you proper hormone replacement testing. I'm Dr. Dave Morris with Magnolia Medical Center here in Murfreesboro, Tennessee. Have a great day.